6 Essential Facts about Sexual Dysfunction. It is a common complication in people with diabetes, affecting both men and women due to a combination of vascular, neurological, and psychological factors. High blood sugar levels over time can lead to nerve damage, neuropathy, poor blood circulation, and hormonal imbalances, all of which contribute to sexual problems. It's a topic that often goes undiscussed. Sexual dysfunction refers to persistent physical or psychological problems that prevent someone from engaging in or enjoying sexual activities. It's quite common, affecting both men and women of all ages. Number 1. Erectile dysfunction. One of the most common sexual problems in diabetic men. It is caused by damage to blood vessels and nerves that control erections. Poor blood flow, reduced nitric oxide production, and oxidative stress contribute to erectile dysfunction. Risk factors include mainly poor blood sugar control, obesity, smoking, high blood pressure, and cholesterol. The most effective measure of blood sugar is range in time. That is what percentage of time the blood sugar was within the approved range. You can measure that with a CGM, but it is not hard to get a good estimate with a regular blood sugar meter by recording after-meal blood sugar. Now, let's break it down a bit. For women, the most common issue is hypoactive sexual desire disorder, which affects about 30% of women. This is when you have little to no interest in sexual activity. But it's not just about desire. About 10% to 15% of women experience orgasmic disorder, which means difficulty reaching orgasm. And around 10% to 15% of women deal with sexual pain disorders. For men, the numbers are a bit different. Erectile dysfunction, which is difficulty getting or maintaining an erection, affects about 10% to 20% of men. But the most common complaint among men is premature ejaculation, with about 30% of men reporting this issue. Hypoactive sexual desire disorder is less common in men, affecting about 15%. Research shows that sexual dysfunctions are highly prevalent, affecting about 43% of women and 31% of men. But here's the thing: not everyone who experiences sexual dysfunction feels distressed about it. The research called PRESIDE study found that while 44% of women reported some form of sexual dysfunction, only 12% were distressed about it. Number 2. Decreased libido in both men and women. Low testosterone levels, common in diabetics, can lead to reduced sexual desire. Depression and stress related to diabetes management can also play a role. But here's something interesting: the prevalence of sexual dysfunction increases with age. For men aged 40 to 70, more than 50% describe some degree of erectile dysfunction. And for women over 65, the prevalence of any type of sexual dysfunction is highest. But interestingly, women in this age group report the lowest levels of distress about their sexual function. Now, you might be wondering, what causes all this? Well, there's no simple answer. Sexual dysfunction can have physical causes, psychological causes, or often, a combination of both. Let's talk about some physical causes first. Hormonal changes can play a big role. Things like thyroid disorders, menopause in women, or decreasing testosterone in men as they age can all affect sexual function. Metabolic conditions like obesity and high cholesterol can also lead to various sexual dysfunctions. Heart conditions can contribute too, causing fatigue and shortness of breath during sexual activity. Number 3. Ejaculatory issues in men. Retrograde ejaculation is a condition where semen enters the bladder instead of exiting through the penis due to nerve damage affecting the bladder sphincter. Delayed or inhibited ejaculation. Nerve damage can also lead to difficulty reaching orgasm. There are also specific disorders that can disrupt sexual function. For men, conditions like prostatitis can cause pain during sexual activity. For women, endometriosis can have a similar effect. Neurological disorders can also impact sexual function. But it's not all physical. Psychological factors play a huge role in sexual function. Things like stress, anxiety, depression, and relationship problems can all contribute to sexual dysfunction. Past sexual trauma, negative sexual experiences, or even just concerns about sexual performance can have a big impact. Number 4. Sexual dysfunction in women with diabetes. Decreased arousal and lubrication issues. Poor blood flow to the vaginal area can reduce sensitivity and natural lubrication, leading to discomfort or pain during intercourse. Reduced sexual desire. Hormonal imbalances and emotional factors like stress, anxiety, and depression can lower libido. Pain during intercourse. Due to vaginal dryness or nerve damage leading to hypersensitivity or numbness. Increased risk of vaginal infections like yeast infections can also contribute to discomfort. Using artificial and safe lubricants can improve the situation in most cases. According to a 2014 study, coconut oil is clinically proven for safe and effective use as a moisturizer. Its moisturizing properties may make the product an effective lube and allow for longer-lasting intercourse. And let's not forget about lifestyle factors. Alcohol and drug use can affect sexual function, as can certain medications. Blood pressure medications and antidepressants, for example, are known to sometimes cause sexual side effects. Now, you might be thinking, this sounds pretty common, so why don't we hear more about it? Well, that's a great question. Despite how common sexual dysfunctions are, many people feel embarrassed or ashamed to talk about them. But here's the thing. Sexual health is an important part of overall health and well-being. If you're experiencing sexual dysfunction, it's important to know that you're not alone. And more importantly, there are treatments available. The first step is often just talking to a healthcare provider. They can help determine the cause of the problem and suggest appropriate treatments. Treatments can vary depending on the specific issue and its cause. For some people, lifestyle changes like exercising more, quitting smoking, or reducing alcohol intake can help. For others, therapy might be the answer. This could be individual therapy to address psychological issues, or couples therapy to work on relationship problems. Wait, there is more, but do not forget to hit the like button if you have found this video useful so far. Research references are in the comments section. There are also medical treatments available. For men with erectile dysfunction, medications like Viagra and Cialis have become well known. But there are other options too, including injections, vacuum devices, and even surgical implants in some cases. For women, there are now FDA-approved medications for certain types of sexual dysfunction. But treatment isn't always necessary. Sometimes, simply understanding what's normal and what's not can be helpful. As we age, some changes in sexual function are normal. It might take longer to become aroused or reach orgasm. But if these changes are causing distress or affecting your relationships, that's when it's worth seeking help. It's also worth noting that what works for one person might not work for another. Sexuality is complex and very individual. What's important is finding what works for you and your partner. Number 5. Causes of sexual dysfunction in diabetes. Neuropathy or nerve damage caused by poor blood sugar control affects nerve signals responsible for sexual arousal and function. Vascular issues. Reduced blood flow to the genitals impairs function. Hormonal imbalances. Insulin resistance can affect testosterone and estrogen levels. Medications. Some drugs for diabetes, blood pressure, or depression may contribute. Psychological factors. Stress, depression, and anxiety related to diabetes can reduce sexual interest and performance. Speaking of partners, communication is key when it comes to sexual dysfunction. Talking openly with your partner about your concerns and desires can often help resolve issues. Sometimes, simply changing up your routine or trying new things can make a big difference. Now, let's talk a bit about prevention. While not all sexual dysfunctions can be prevented, there are things you can do to maintain good sexual health. Staying physically healthy is a big one. Regular exercise, a healthy diet, and maintaining a healthy weight can all contribute to better sexual function. Managing stress is also important. Finding healthy ways to cope with stress can have a positive impact on your sex life. It's also important to take care of your mental health. Depression and anxiety can have a big impact on sexual function. If you're struggling with these issues, seeking help can improve not just your overall well-being, but your sexual health too. And let's not forget about regular checkups. Seeing your healthcare provider regularly can help catch and address any health issues that might affect your sexual function early on. But there's one more thing I want to emphasize. Sexual dysfunction is a health issue, not a personal failing. It's nothing to be ashamed of. If you're experiencing problems with sexual function that are causing you distress, don't hesitate to seek help. Your healthcare provider has heard it all before, trust me, and remember, sexual health is just one part of overall health. Taking care of your body and mind in general can go a long way towards maintaining good sexual function. Eat well, exercise, manage stress, and don't be afraid to talk about any concerns you have. Lastly, let's talk about the impact of sexual dysfunction on relationships. It can be a source of tension and conflict if not addressed. But it can also be an opportunity for couples to grow closer by learning to communicate more openly and work together to find solutions. Many couples find that dealing with sexual dysfunction actually strengthens their relationship in the long run. Consult your healthcare professional before changing your medication or lifestyle. Number 6. Management and treatment. Blood sugar control. Proper diabetes management can slow or prevent nerve and vascular damage. Lifestyle changes. Regular exercise, a healthy diet, and weight management improve circulation and hormone balance. Medications. For men, PDE5 inhibitors, Viagra, Cialis, testosterone therapy, if low, and penile injections. For women, vaginal lubricants, estrogen therapy, if needed. Psychological support. Counseling or sex therapy can help address emotional and relationship concerns. Medical devices. Vacuum erection devices for men, pelvic floor therapy for women. It's a complex topic, but an important one. By understanding it better, we can work towards better sexual health for everyone.